Hi, Abby. How you doing today?
Good, good. How are you?
I'm good. You're in Michigan, and it is December. Are you staying warm? What's the temperature outside today?
I'm trying. It's in the mid 30s, so we've seen
Oh,
worse.
wow. Yeah, that's downright balmy. Wow, that's pretty good. Global warming, climate change, whatever. Yeah. Anyway, I really appreciate you taking a few minutes to speak with me today. And why don't we just kind of dive right into it? We first met toward the beginning of this year. I believe it was in May. And tell me what was going on with you with regard to your headaches at that time.
Sure. So I've always had migraines since I was a kid. And so I've been battling them for a while. My pain was starting to increase on the back of my right side.
Hmm.
Um, and we kept trying things. We kept trying different medications. We tried nerve blocks. Um, and they would help in the beginning, but it just kept getting worse. And so I finally just started doing my own research. And I happened to join a Facebook group, and they couldn't stop ranting and raving about how great you were.
Uh, yeah, I
And
have a lot of great
so,
patients in that regard. So yeah.
so I found your contact info and reached out, and was hoping that it would be the right thing for me.
Yeah. And so, kind of fast forward through everything, you came out to see me, and we determined it was three nerves in the right side of the back of your head.
Right.
And we did surgery on them about 6 months ago, a
Yep.
little over. Um, what was your operation experience like? How was it after surgery, in other words?
It was interesting, but it was good. I honestly, even though I still had some of the medication still in my system, the minute I woke up, I felt like I could already feel better, which
Okay.
was incredible because it up until that point, um, unhyperbolically had been exaggerating or exacerbating just terrible pain
Yeah. Yeah. Yeah.
and
So you noticed a
unrelenting.
difference almost right away.
Yeah,
Yeah. Okay.
which was awesome.
Yeah. Great. All
Um,
right. So yeah, go ahead.
yeah, just the flight home was not that bad. I had plenty of medication to get me home. I did take a week to recover before I went back to work.
Mhm.
Um, I have an office job, so there weren't too many concerns about overworking
Mhm.
my scar or my
Or yeah,
incision or anything.
yeah,
Um, and yeah, I was just taking it a day at a time, making sure I felt so much better that I had to remind myself that I was still recovering and
yeah,
not to push it too hard.
yeah. Got it. And you obviously did the right thing, because here we are, a little over 6 months later. Tell me what things are like now.
It's awesome. I don't even have any pain on the back here. All I have is a little bit of sensitivity to cold as winter is coming.
Yeah.
And but just making sure I wear a scarf and it's no problem.
Uh,
But other
how's
than that,
your how's your sensation overall on that side?
so so we cut two of the nerves back there,
Yeah,
and the greater occipital nerve is intact. So
yeah.
for the most part, I'm surprised at how much feeling I still have.
Hmm.
So it's not you get used to it after a while. There's a little bit of numbness in certain places, but it's not even, I would say, uncomfortable. It just took a few weeks to get used to it,
Hmm.
get to the new normal, if you will.
Yeah.
And
And is
otherwise,
that changing with time? Are you noticing less and less numbness with time?
I am absolutely. Yeah.
Yeah, and that's very likely to continue to the point where probably about a year after surgery, and as you know, I torture all my patients and call them at a year after surgery just to, hey, how's everything still going? And that's one of the questions that we'll talk about. And by that point, certainly when people are where you are at 6 months, that's what they're saying at 12 months. So like, yeah, I don't think
Oh
there's
wow.
any of this, and they start looking for areas where they don't feel stuff, but they can't find them, which is great. So Kind of as a final thought, sounds like this has been a near home run here. And any advice to the other people out there thinking about this, things you wish you had known beforehand, or that you now know afterwards, that you want to pass on to someone who's kind of been through this experience?
Yeah, absolutely. I would say my biggest piece of advice would be, don't be afraid to do your own research. I have seen a handful of different neurologists, and they were all great doctors. They were nice people, and they were trying to help me the best they could. But at the end of the day, it was my pain, and I knew my body, and I needed to figure out what to do. And like I said, I was, on different websites like John Hopkins and whatnot. But I also joined a Facebook group sort of more as a support mechanism. And that was where I finally met people who actually understood what I was going through. Up until that point, it was like I was trying to describe something totally foreign.
Yeah.
And so taking that step and just taking control of my the way I handled my pain, and just saying, all right, I'm gonna do it, and just do it my way, and it made all the difference.
Yeah. So I think that's great advice, and a really wonderful message to send out to a lot of people. I think you know your body the best. Don't let anyone else tell you different, especially when they make a value judgment. Oh, it's not that bad. You can still do this and do that. And so you just have to deal with it, or you're too old. You should expect some degree of pain. I mean, again, it's amazing what people say to other people. So I really appreciate all the things you're saying. And look, I'll close it out and say, really appreciate you taking some time out of your busy day. So happy that you're doing so well. We will be speaking again in another 6 months, but as always, the doors are always open if something comes up in the interim. Thank you again so much for taking some time to talk with us. Really appreciate it.
Yeah, no problem. Thank you so much.
Cheers. All right. So